Well, I want to thank the counties for all their hard work. And I also just want to say and add about Safer at Home as you look over the next couple weeks. Every day where you can make progress against this virus is a huge, huge deal. And the reason is once this thing started rearing its head, we saw it in China. There were things that, we were monitoring in Florida. CDC was monitoring everything. But private industry and innovation have really kicked in over the last month. And you have new things coming online, it seems like, almost every day. You're going to have, Mayor was talking about the antibody test to try to figure out how many people have had this. I got to believe that this thing was swirling around Miami during the Super Bowl. How wide was the infection? How many people are asymptomatic? How many different tests are there going to be where you literally will get the results within 5 minutes? So there's all this innovation that's happening. So the more you can do now to stop the spread, the greater opportunities you're going to have to ultimately defeat it, because you're going to have so many more tools at your disposal. We learn more every day as we get in more information, not only at the local level, state level, but what they're doing in Washington. And it allows us to be smarter. But American innovation is ultimately what's going to win the fight against this. Let's give it a little bit more time to develop even more tools. And if we're doing that, then I think that we're going to have a great chance in this. So thank you all. And remember, the message is safer at home. With that, yes, ma'am. Thanks. Well, that's what we're doing now with this. I mean, we have South Florida we view as our epicenter with 60%. But just understand, we were working with Mayor Gimenez, we were working with Mayor Holness, we were working with those counties from day one. And I have issued orders specific for South Florida already. Now this is yet another one. And so we definitely view the Southeast Florida region as a unique part of the state, particularly when you talk about a virus that started internationally and then obviously spread seriously in New York City. Both of those impact Southeast Florida. And so I think a lot of what the counties have done, a lot of times in conjunction with us, has been very aggressive. We've supported every step they've taken, and I think this is yet another example of that. Yes, sir. It's the million-dollar question. I mean, so when we started this, we were one of the first states, Jared's here, we were one of the first states to order all this stuff. That's why we have the field hospital set up. That's why we have additional beds. That's why we're finally starting to get the testing swabs. We ordered 500,000 of those right off the bat. And the PPE was something. So what'll happen is there'll be PPE that's supposed to be delivered at some port. You go and ends up somewhere else. It's really cutthroat. The president talked about it yesterday. We're going to look into this FDA approval for cleaning the PPE. Look, obviously we'd like to have unlimited supply, but at least if you can do that, then they're able to do it. So PPE is a top priority, and I think we're going to continue pushing for it. We are getting some in. But then, like, they'll say you're going to get another 500,000 next week, and it's like, all right, here's 25,000. It's cutthroat, and that's just the nature of it. But when you look at some of the things that we have an opportunity to do, if we get the rapid test, all the healthcare workers will be able to get a result in 5 minutes. That's game-changing for protecting the healthcare workforce. So there's a whole bunch of other things that we want to do as well, but certainly the protection of the healthcare workforce is one of the top issues. What's that? I think it varies by region, to be honest with you. One of the things I did early on was we suspended any type of non-essential medical procedures. And part of the reason we wanted to do that was to make sure that we could expand the amount of beds in case you had a hospital surge. But as I started talking to folks, that was really the secondary reason to do it. The number one reason to do it is because you didn't want to burn through PPE. We just had a baby, and I wasn't in the delivery room because we didn't want to burn the PPE. My wife and I both said, look, let that be for the medical professionals. So that's just, it's something that we're working very hard to conserve. Yes, sir. Yeah, no, absolutely. And we're going to be able to beef up. So we have the testing site here, Marlin Stadium, and we're going to be sending more swabs because as they come in, we get them out. And so clearly, Miami is a great. You look at some of the. The testing in Miami, there just wasn't any testing being done here. Like I said, I think that this was circulating in February, but I think it was people would go and it was an influenza-like illness and it just wasn't clear. And then once you started, because at first the CDC said just test people if they come back from China. Well, I mean, there's a lot more people that have been through South Florida. So once we've been able to flood the zone with tests, you've obviously seen more positives. But I think those are identifying things that were probably there. And so now that we've kind of sensed where we're at, as we continue to get results, I think it allows you to make much better decisions. But if I could have unlimited PPE and rapid testing, if I have those two things, and we may get those very soon, that's a huge game changer for us and allows us to be even stronger. Yes. Well, no. So first of all, I'm not supportive of that. Obviously, the county, they're in charge of the port. We've talked to the Coast Guard. The Coast Guard, I don't think wants them to come in. I've talked to the White House about it, and we don't want it to come in. And here's the issue. We met with, Mayor Holness was there, and Mayor Gimenez, we met with all the cruise ship people several weeks ago and said, look, guys, and Vice President was basically like, I'm not saying we're going to totally shut you down, but if you can't operate safely, and they said, no, they were going to take things. So here's a situation where there's nothing about Florida where this ship should necessarily, that's just a convenient place. The problem is then that takes resources away from the folks in South Florida. And yes, we do have available beds, but I don't want to be a situation where those beds could have gone to Floridians. So I think the thing is they need to get medical care out on the ship, and they can work with some of the folks in D.C. or whoever, get it out there, administer the care to the folks there. That averts, I think, which would potentially be a big problem. And, we have enough to deal with our folks in Florida. We've got almost 22 million people, just this area, heavily populated. These guys are working round the clock to support those folks. Having people from other states flee to here or have a cruise ship come in, it creates problems, and we want to focus on Floridians. Yes, sir. So I don't believe I am. I think the county can vote to do that, and I think they're considering that. I've also I think the White House obviously could divert it, and so we're in touch with them. They're supposed to give me an answer on that sometime today, but I'll let the mayor weigh in about the county's perspective.
So as of just a few minutes ago, we have not yet received a request for them to berth. We know that the intent is that they come here. We will have a meeting tomorrow morning at 10 o'clock where we'll further discuss what action we take. But clearly what must be done is that we safeguard the people of South Florida and of Florida. And they haven't given us a full list of all those who are on board and what the conditions are. So there's a lot of work that is yet to be done for us to understand more fully who's on there, what the situation is. But as the governor says, the possibility of having them treated on ship is one that ought to be taken into serious consideration. So there's a lot of work still to be done. There's a lot of things up in the air that we have to figure out. But let me tell you also that at the port, we have a unified command with the Coast Guard, with the Center for Disease Control, with Florida Health Department, with Customs and Border Patrol, with the Broward Sheriff's Office, with the pilots at the port, and with our administration. So whatever decisions being made, that information will be filtered through all of that before any decision. And those conversations will be had tomorrow at our meeting. Tomorrow, yes. Tomorrow there will be discussion on that for certain. We'll have the discussion on it tomorrow, and some determination will be made.
All right. Yes, ma'am. Thanks. So I don't know that they're not. I mean, you'd have to ask Department of Health on that. I can tell you that if we get the Abbott Labs test, the first place we're going is our senior communities, the assisted living facilities, and the nursing homes. Not just to test the residents, but when people are working, because what happened in Broward was you had staff that were sick that were in there, even though we knew they knew that was something you shouldn't do. So you'd be able to test the staff 5 minutes, but then you also will be able to liberalize visitation, because we've walled off these things, and we're doing it for the protection of some of our seniors. But I think that that's not easy on them. And if you have a son or daughter who can test is negative and they can go in and spend some time, that reduces some of the anguish for these folks as well. So I think the rapid test is going to be a great tool to deploy at nursing homes and at assisted living facilities. And I do think that it's a top priority. But let me just say this: for every, you have the Broward situation. There was one in Jacksonville. We send people from ACA to spot check to do all this other stuff. And some of these facilities are doing amazing work. They are super cautious on everything, and have done a good job. So you see one, and obviously there's investigations going. I think that people are going to be disappointed in how that worked out. But there's also a lot that are doing well. Yes, sir.
The state is reporting systems a couple of days behind what reality was the testing from the lab, etc. Do you feel like you have an adequate?
Well, it's not behind. I mean, so our reporting system in Florida, in terms of how we report to the public, we do it quicker than anybody. If you look at our website and look at other states, we have way more information than other states. In fact, people have said, I wish everyone was like Florida on that. So as soon as we get it, the public has it, and then we know. Now, you're right. Someone may have been tested, positive, and that may reflect 4 days before. So you look at it. But I think what we look at is trends. Once you have a certain number of tests, Broward is pretty consistently 90% negative. So as we've increased testing, they've had similar positive ratio. Miami's a little bit, more. But as the mayor has pointed out, the number of positive tests, that is one thing you look at, but understanding how this disease affects different people differently, looking at what percentage of those folks are 65 and plus, what percentage of those folks have a serious underlying condition, and then what's the net hospitalization, and then obviously you want to avoid fatalities. So Miami's numbers, as you've had the infections reported higher, their hospitalization rate, I would say, is definitely below the national average for what you guys have. 6% in Miami, between 6 and 7. So those are the things that you're looking at. And especially, remember, flattening the curve is not saying that we can stop the virus at all. I mean, it's kind of a recognition. Respiratory virus, it just has a way of getting out. So you take these measures so that you're shifting some of these infections further into the future so the healthcare system doesn't get overwhelmed. So that's the type of thing, looking at the test results, but then seeing how that's affected our hospital and our healthcare system. That's really the two things. They go hand in hand. Yes, ma'am. Right. You have to ask my communications. I do not, deal with the press conferences. I just go up and do my thing, and so I'm happy to answer. Obviously, you're here now, and I think I've answered more questions than just about any governor since I've been governor, and I'm happy to do it. Yes, sir. Well, but I would say, so, I mean, we've gone from, even with limitations on the type of testing you're doing, you went from probably when CDC was doing it, if you go back and look at it, they were not even 1,000 tests done. So then we've gotten involved and we've worked with the locals and we have had some federal support. And then you now have tens of thousands. I mean, Broward's at least 10,000 tests. Miami's 10,000. So we're going to keep doing that. If I get the rapid tests to come in, they're going to be making 50,000 of those a day. So Florida, I asked the president personally, not that they have to pay for it for us, but all these manufacturers are looking to the White House about where they should send stuff. And my pitch on Florida was, look, I have a spot in Southeast Florida. If I could rapidly deploy that, particularly amongst in the senior community, we would be able to really have measures that would be in place that would be pinpoint of what we need to do. And so I think that that would be something that would just be absolutely phenomenal. But as frustrating as the testing has been, we in February, when the only people that were being tested per CDC was if you had been in China. So we were actually isolating people for 14 days if they had come back from China. Then you added Italy. But if you were just someone here with symptoms, CDC says that you didn't need to be tested. I don't think they thought that the virus was really present in our country, and that may obviously have been incorrect. And so had the testing been a little bit more robust, we may be in a situation where we would know the better baseline. Because I know that had Miami tested, and it's not Miami's fault, but had there been more tests, I think you would have obviously seen more positives in late February than you have right now. But we're much better shape we've done over 50,000 tests in basically 2.5 weeks in Florida. When you look, when we stood up the guard, when we really started ramping this up, and I think we'll do, we're probably going to be doing, once we have the Palm Beach site up between Broward, we're going to be doing thousands and thousands every single day. And I would point out, we have set up sites around the state. Fortunately, there are some parts around the state where a testing site gets very little traffic. There aren't as many people that have symptoms. I think that's a good sign. But as we see the need, we obviously are willing to shift resources. One more. Yes, ma'am. Yes. I'll let you go too. But they wanted to ask about the baby, so let me brag just a little bit. It's surreal being in a hospital during this time. And as I said, I did not go into the delivery room because of I didn't want to burn PPE. It was a kind of sad thing, but my wife and I both felt that was the right thing to do because really there's going to be people that need it more than us. And then to have a third, she was the smallest of the bunch. But it's like when my daughter was first born, my older one, it was the prettiest thing I'd ever seen. And then my son, he's a cute kid. But I'll tell you what, this one is really, really cute. And so and she's sleeping very well. And this is a tip for parents. My son's 2. This wasn't in existence when he was even born. It's a technology. There's a thing called the SNU bassinet. And you put the baby in there, and there's sensors and microphones in the bassinet. And so if the baby starts to cry, it logs it, and then it tries to figure out how you do noise, movement. What do you do to soothe the baby? Then the information goes to my wife's smartphone, and you see it. So last night, we put Mamie in the bassinet, and she started crying, and then the thing just started doing all this stuff. And guess what? She didn't make a peep all night. So the SNU, look, if one night's any indication, it is definitely worth your money if you're a young parent and you care about your sleep. One more. Yes, ma'am. So what's happened is when that happens, so like in Jacksonville, they did 65 and plus with symptoms, and then first responders and healthcare workers. The traffic was so light that they basically said, look, if you have symptoms, come in. And so that expanded the pool a little bit. So I think it's the call of here. My view is, as much as we can expand without giving people a false hope, like if we have the supplies, expand it. I think that's a good thing. It's interesting in the numbers. Statewide, you look at the infections, but you also look at them by age group. And we actually are seeing more infections, I think, reported than we thought in that 20s to 30s and even 40s. Those folks, if they don't have an underlying condition, tend to get out of this much better. And so I think that that's something that is important to understand. We're also trying to work with CDC, and I think they're trying to set it up. But with the flu, now obviously everyone that has the flu doesn't go in and get tested. You kind of just deal with it. But we have deaths. I mean, Florida, even though we have one of the lowest death rates, we got about 3,000 deaths a year from the flu. So what they do is they do spot sentinel testing, so they see where the flu is popping up in different parts of the state. And so they were going to do something similar for COVID-19. And the idea is you're testing a representative sample of society. If you start to see some positives, in, say, like North Miami Beach or wherever, then you can do resources accordingly. So I think that sentinel testing, once that's in place, and I think that's going to be more of a federal deal since the flu is a federal deal, that allows us to really see if it starts cropping up. Because, we're obviously thinking about, safer at home. We're thinking about getting through stopping the spread. But I think everyone realizes, like, you can't do this indefinitely. You're going to have society function again. And what does that look like? Well, having this type of information allows you, to have a functioning society. And it may look a little different because this thing isn't going to totally go away. But I think it will allow people to hopefully have some peace of mind, but also, be a little bit more involved as they're used to doing. So thanks, everybody.